this is an individual tragedy as well. Autism destroys families. More importantly, it destroys our greatest resource, which are our children. These are children who should not be suffering like this. These are kids who, many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old. And these are kids who will never pay taxes, they'll never hold a job, they'll never play baseball, they'll never write a poem, they'll never go out on a date. Many of them will never use a toilet unassisted. And we have to recognize we are doing this to our children.
In his first press conference as Secretary of the Department of Health and Human Services, which occurred during Autism Acceptance Month of all times, conspiracy theorist and anti-vaxxer RFK Jr. continued his long record of autistiphobia by making hateful and outright false comments about autistic people and expressed his aim of eradicating us. Initially, this was going to be one big video unpacking the entirety of that press conference, but there was just so much wrong with what Kennedy said that my notes turned into pages and pages of chaos. So I've narrowed it down, and today we're just going to focus on assessing whether or not there truly is an autism epidemic, as he claims. In saying that, I do think we should briefly cover what autism is to provide some context and make sure we're all on the same page. Within the human species, there's a wide diversity of neurocognitive styles, which are essentially different types of mind. Autism is a term to describe one such neurological variant. Most people have a neurocognitive style that we'd refer to as neurotypical, with those whose neurology differs significantly from this dominant type being referred to as neurodivergent because they diverge from the dominant type. Autism is one of many forms of neurodivergence and one that is fundamental to the autistic individual's personhood. You can't separate the person and the autism physically or conceptually because the person is autistic. In a vacuum, being autistic is no better or worse than being neurotypical. They're both just neutrally different ways of thinking, feeling, moving, communicating, and overall experiencing the world. Autism is not a disorder, a mental illness, or an inherent deficit. It's simply a neutral neurological difference. As such, wanting to cure us, with cure being in big quotation marks, and or eugenics is out of existence, is just as bigoted and unacceptable as wanting to do the same to gay people, trans people, black people, indigenous people, or any other group who are just neutrally different from what's currently considered the norm. The aforementioned conference premises on the latest Autism and Developmental Disabilities Monitoring Network survey from the Centre for Disease Control and Prevention that was recently published in their Morbidity and Mortality Weekly Report. Note all the pathologizing words in that one sentence. As a slight tangent, the CDC uses language that suggests they view autism as a pathology, which is sadly expected, but at least they're not spouting outright disinformation like the Trump administration is, and they seem to be promoting support for autistic people rather than eugenics. Anyway, this survey, in short, went through a bunch of school and medical records of 4 to 8-year-olds in 16 US sites looking for autism diagnostic codes or any other documented indicator of autism. Numerous other studies similarly point to ongoing increases in autism diagnoses across a range of different age groups and geographical areas. It's safe to say that there is in fact an ongoing increase in autism identification and diagnosis. Kennedy, however, misrepresents these statistics by stating,
autism is increasing in prevalence at an alarming rate.
This is most likely false. An increase in autism identification, which is happening, doesn't necessarily mean a meaningful increase in autistic people, but Kennedy continually conflates the two. I personally suspect this conflation to be deliberate instead of a careless but honest oversight. He can lean into the autism epidemic narrative while leaving the wording ambiguous enough to provide plausible deniability. We'll get into that shortly, but hypothetically, even if autism itself is becoming significantly more prevalent, why would that be a bad thing? It would only be seen as a bad thing to those who misperceive autism, and by extension autistic people, as bad, undesirable, or shameful in some way. Instead of recognizing autism as a neutral form of diversity that is an immutable part of an autistic person's personhood, Kennedy depicts autism as a preventable chronic disease that needs a treatment and cure. Our existence is a tragedy characterized by relentless suffering. We do suffer, but not because of anything innately wrong with us, but by being systemically abused, marginalized, and oppressed. That's the real tragedy. Furthering his autistophobic bigotry, Kennedy calls this alleged autism increase, quote, alarming, quote, catastrophic, and, quote, an epidemic. He also previously referred to this purported autism increase as a holocaust, which, aside from being disgustingly offensive to victims of actual holocausts, just doesn't make sense. In this same instance, he presented as fact the imaginary scenario wherein quote-unquote normal children would be suddenly infected with autism via vaccines, at which point, quote, their brain is gone. So perhaps this Holocaust writing could refer to what he sees as a mass destruction of normal children who, upon being contaminated with autism, are left as empty shells of their previous selves. This is both inaccurate and dangerously depersonalizing. But above all, Holocaust is such a weighty word, and I think he mostly exploited it for shock value to further his fear-mongering. Ironically, Kennedy is propagating the idea of us being human belasts, life unworthy of life, which is the very rhetoric that led to the genocide of our autistic and disabled predecessors under the Nazis' T4 euthanasia program, and later being enslaved and murdered along with the other so-called undesirables during the Holocaust. Upon receiving backlash, he settled on calling us an epidemic, as this is seemingly as offensive as he can get without serious rebuttal. Referring to our existence as an epidemic is still revolting and, of course, false, and doesn't solve the core issues with his statement and ideology. Kennedy goes on to whack out a load of numbers from the CDC report and misframes them as proof of a big, scary autism epidemic, which he and other autistophobes have been fear-mongering about for decades. He blatantly cherry-picks and warps stats to support his preconceived narrative while disregarding anything that's inconsistent with it, which is almost the entire study. For instance, he conveniently neglects to mention how, quote, demographic patterns in ASD identification changed. Before 2016, The highest ASD prevalence was observed among white children. In 2020, higher ASD prevalence was observed for the first time among historically underserved groups, including non-Hispanic Black and Hispanic children." End quote. The most recent survey continues this pattern, with autism identification being lower among white children than in other groups included. The authors additionally report, quote, "increased access to identification among previously underserved groups," end quote. This data supports the scientific consensus of rising diagnostic rates being overwhelmingly due to a better general understanding of autism, leading to more autistic individuals being identified as such, rather than there being a significant increase in actual autism prevalence. As well as better and more equitable diagnostic services, the modern criteria for autism is substantially wider than that of past decades, so more people qualify as autistic now. With general population growth, there probably are more autistic people. It could be argued that perhaps improved support for autistics means that more of those who want to have biological children can be in a position to do so. And since autism is largely genetic, more autistics reproducing means more autistics. Assuming these things to be true, this slight increase in actual autism prevalence would be nowhere near enough to account for the large increases in autism diagnoses we're seeing. For a long time, autism was associated almost exclusively with little white boys, especially those who had intellectual disabilities and or generally higher or more obvious support needs. Consequently, adults, AFABs, people of colour and those without intellectual disabilities and or who tended to need less support were notably underdiagnosed, along with anyone who could excessively mask or camouflage. While there still are undoubtedly diagnostic biases related to gender, race and ethnicity, socioeconomic status, and other individual characteristics such as perceived intellectual functioning, we're incrementally improving on this front. Now that we understand that autism isn't just a white people thing, and there have been some efforts towards making access to diagnostic services more equitable, it's logical that the CDC reports increased identification of autistics of colour, which contributes to the overall increasing diagnostic rates. The authors report, quote, "increased identification of autism, particularly among very young children and previously under-identified groups. Children being identified as autistic younger, when their autisticness might not be as obvious, supports the theory of better and less discriminatory diagnostic practices and services due to improved understanding and education. More autistics being identified as young kids means higher diagnostic rates, and they're not waiting decades to be formally identified as autistic. Not too long ago, very few people had ever even heard the word autism, but now almost everyone has. While most people don't understand what autism actually is and tend to inappropriately pathologize us, many can identify certain behaviours and traits as potential autistic behaviours and traits. As such, parents, teachers, paediatricians, etc. are much more likely to link behaviours such as avoiding eye contact or hand flapping or repeating certain signs as potential indicators of autism, so more children will be referred for evaluation compared to previous decades. It's also worth noting that children who are suspected or known to have Down syndrome, ADHD, dyslexia, cerebral palsy, Tourette's, intellectual disabilities, or some other disability or diagnosable difference are often also evaluated for autism, which wasn't standard in past decades. While still far from perfect, if the goal is to estimate actual prevalence, perhaps a better method would be to use birth year instead of the year of diagnosis. For example, I was diagnosed back in 2018 when I was 15. That's +1 autistic for 2018. But I was autistic for all those years prior, so why not instead add that +1 to the year 2003 when I was born? Using birth years makes even more sense when considering the significant amount of late identified autistics. Sometimes referred to as the lost generation, these people were undiagnosed for multiple decades, and many were born when the concept of autism was radically different than our modern understanding. To further support that autistic identification is improving rather than there being a meaningful increase in autism prevalence, the study also mentions that before 2016, the highest ASD prevalence was observed in children from neighbourhoods with higher socioeconomic status, while this report, as in 2020, found no significant association between autism identification and socioeconomic status in the majority of sites involved. This shift would suggest more equitable diagnostic services and fewer economic-related barriers to diagnosis and support services. This is quite a long direct excerpt from the study, but I think it's very relevant. Quote, "Differences in the prevalence of children identified with ASD across communities might be due to differences in availability of services for early detection and evaluation and diagnostic practices. For example, California has had the highest identification prevalence among children aged 4 years and 8 years since joining the ADDM network in 2018 and has a local initiative. As part of the initiative, hundreds of local pediatricians have been trained to screen and refer children for assessment as early as possible, which could result in higher identification of ASD, especially at early ages. In addition, California has regional centres throughout the state that provide evaluations and service coordinations for persons with disabilities and their families. Another reason for differences in prevalence could be whether the children have insurance coverage or meet eligibility criteria for access to early intervention services. Pennsylvania, the site with the second highest identification prevalence among children aged 8 years, has state Medicaid policy that includes children with physical, developmental, mental health, or intellectual disabilities, regardless of parents' income. Puerto Rico was the site with the second highest identification prevalence among children aged 4 years, but identification prevalence among children aged 8 years in Puerto Rico was below the ADDM network average. Higher ISD identification in the younger cohort could reflect dedicated joint efforts since 2017 by the Puerto Rico Title V Children with Special Health Care Needs program and the Puerto Rico Learn the Signs, Act Early ambassador to decrease the age when children at risk for ASD receive their first diagnostic evaluation. These efforts have included developing and widely disseminating clinical protocols for early identification and diagnosis of ASD across Puerto Rico, increasing access to diagnostic evaluations at the Children with Special Health Care Needs program Autism and Pediatric Center for children aged up to 3 years, and providing all parents of newborns in Puerto Rico with a guide that includes information about developmental milestones and early ASD signs, among other activities, end quote. While the use of the phrase children at risk for ASD displays the author's misperceival of autism as a pathology, their interpretation of the data makes complete sense and aligns with the scientific consensus. In reference to California's autism identification numbers, Kennedy states,
"And is high in California, which has the best data collection, so it probably also reflects the national trend."
He fails to mention California's local initiative and region centres that provide evaluations, as the authors of the report discuss. Also, if California has the best data collection while also having the highest identification prevalence, surely that would support the widely accepted theory of there being better identification of autistics rather than a meaningful increase in autism. I mean, At least he qualified probably instead of his typical tendency to present his personal convictions as undisputable fact. But the very report he's using to further his narrative explicitly states, quote, "The populations within site-defined ADDM network surveillance areas are not nationally representative and do not generate nationally representative ASD prevalent estimates." And this guy has the audacity to tell us to read the study.
All you have to do is start reading a little science, because the answer is very clear. And this is catastrophic for our country.
So, to summarize all this, RFK Jr. uses the CDC report as his main proof of an autism epidemic, but this very report disputes pretty much everything he says. So, is Kennedy simply unaware of these very logical explanations? Did he somehow overlook 90% of the very study he's holding a conference about? No, he knows. This isn't a case of simple ignorance, but a deliberate framing of a narrative to stir up unwarranted public panic. Perhaps this is an unpopular opinion, but I don't think Kennedy is stupid. Rather, I think he deliberately contorts things to fit his narrative, while simply dismissing anything that challenges it, even if this is indisputable evidence. He has an agenda, and he's using anything he can to further it. Kennedy actually mentions these hypotheses, the ones that pose that autism prevalence is not significantly increasing, but rather diagnosis prevalence is significantly increasing due to more awareness, better, earlier, and more accessible diagnostic opportunities, and the widening of diagnostic criteria. He doesn't debunk these well-founded theories or suggest potential flaws with them. Instead, he declares,
The epidemic is real.
more or less saying, they're wrong without meaningful follow-up, fallaciously presenting them as some kind of conspiracy theory, which he calls, quote, epidemic denial.
One of the things that I think that we need to move away from today is this ideology that the autism diagnosis, that the autism prevalence increases, the relentless increases, are simply artifacts of better diagnoses, better recognition, or changing diagnostic criteria. If you look at Table 3 of the ADDM report, it's clear that the rates are real, that they are increasing in the last 10 years, which is beginning with the first one, year by year there is a steady, relentless increase.
As we've already gone through, the CDC/ADDM report is surveying autism identification, which, as the authors mention, is not an accurate or reliable indicator of actual autism prevalence. Contrary to Kennedy's framing of these figures, the authors stipulate that these figures, quote, are not nationally representative and do not generate nationally representative ASD prevalent estimates, end quote. It's not like we have some sort of autism blood test or brain scan or something that allows us to objectively test the whole population. Over time, as identification improves, diagnostic numbers should become increasingly more accurate as an indicator of true prevalence, but we're not there yet, and even if/when we do, we still wouldn't be able to use past data on diagnostic prevalence as a proxy for actual autism prevalence. In attempts to support his autism epidemic narrative, Kennedy mentions Table 3 of the ADDM report. But when we look at Table 3, it presents the availability and distribution of IQ scores among 8-year-olds identified as autistic by site, sex, race, and ethnicity, which doesn't support anything he's saying. Perhaps I'm missing something, or perhaps he meant to reference another table or figure, but even so, none of them support the notion of an autism epidemic. Kennedy knows that the average person watching his press conference doesn't have the time and/or motivation to seek out specific studies and fact-check every single claim he makes, so he feels confident in just saying whatever, regardless of factuality, and is exploiting these people's trust in public officials.
This epidemic denial has become a feature in the mainstream media, and it's based on an industry canard. And obviously, there are people who don't want us to look at environmental exposures.
In response to us explaining how there isn't actually an autism epidemic, those who injudiciously trust Kennedy's opinion will be more likely to dismiss us as being epidemic deniers and forgo critical thinking. And if anything, the mainstream media, including the more progressive outlets, is overall harming us due to their ignorance and hesitancy to involve actual autistics in media that surrounds us. Many still platform stories of alleged autism reversal and promote whatever the new autism cure is purported to be, all of which is based on autistophobic pseudoscience and displays a fundamental misunderstanding of autism and autistic people. Scientists don't yet know for sure how autism arises, but there's compelling evidence that it begins in the womb, with genetic components being largely involved. It's thought that autism can arise via multiple different pathways and with the involvement of different gene combinations. Instead of being one unitary neurological variant, autism may be a collection of multiple highly interrelated neurological variants, which could further explain the wide phenotypic variability. There might well be some environmental factors that interact with genetic factors to result in or increase the likelihood of a baby being born autistic, but it's very, very unlikely that there's one specific environmental factor that directly causes autism. Despite Kennedy's conspiracy allegation, there are masses of studies of varying validity that focus on environmental factors. Advanced parental age, premature birth, and low birth weight, for instance, have all been correlated with an increased likelihood of autism, though no causal links have been evidenced. Again, ignoring the science, Kennedy proclaimed,
"This is a preventable disease. We know it's an environmental exposure. It has to be. Genes do not cause epidemics. They can provide a vulnerability. You need an environmental toxin."
autism being not a disease, but an immutable part of us as autistics, is only preventable if you consider eugenics or genocide as viable prevention methods. He just says stuff, and with so much confidence, especially given that he's going against the scientific consensus. Of course, the scientific consensus is not always correct, but if you're going to counter it, you're expected to provide some sort of evidence. Instead, Kennedy asserts his personal convictions as definitive truth. Instead of acknowledging all the evidence that autism is largely genetic and perhaps reconsidering his stance, Kennedy is so adamant that he backward reasons and circular logics that all the science must be wrong and there has to be some environmental toxin causing this awful disease. And within a mere few months, he will find the answer. Or more accurately, he'll configure some Wakefield-esque pseudoscience and reveal to us what he has already decided is the cause, probably vaccines.
I do believe that autism does come from vaccines.
I think it's fine to look into potential links between certain environmental factors and autism if it's solely out of scientific curiosity. Perhaps it could even enhance understanding of autism in some way. Of course, there are much more productive studies that could be done if the aim was to help the autistic community. But Kennedy and the wider Trump administration's aim in executing these studies is to facilitate the eugenic eradication of autistics. Even if external studies are motivated by innocent curiosity, there's still a risk of them being exploited by those who don't want us to exist. To add insult to injury, instead of using taxpayer funds to do something actually useful and in the public's best interests, such as creating and maintaining a nationalised health service, the US government are misappropriating tax money to systemically brutalise farmed animals, to facilitate the genocide of Palestinians, to fund corrupt police departments so they can fatally shoot some more people of colour, and now US taxpayers are going to be funding the Autistic Extinction Mission. And we're supposed to believe that this is a democracy. If we're to glean a positive here, Kennedy's refusal to acknowledge the overwhelming evidence of autism being largely genetic and his insistence on some consistent environmental factor makes his eugenics mission more difficult. If he accepted the genetic underpinnings of autism, he could just forcibly sterilize all of us. I sincerely believe the Trump administration could get away with doing this if they wanted to. But then again, we really don't know what they're premeditating here, or at least I can't figure out their true motive, but whatever it is, it's almost certain to cause huge harm. We're already experiencing repercussions of the vaccines cause autism farce, which Kennedy is a large proponent of and I fear he's only going to double down on. Anti-vax scare tactics have led to more parents refusing to vaccinate their children, which risk the re-emergence of long-controlled, potentially deadly infectious diseases. For instance, there have been multiple recent measles outbreaks throughout the US. We're less than halfway through 2025 and there have already been 3 measles-related deaths recorded in the US. Unvaccinated young children are at highest risk for measles and its complications. Notably, the MMR vaccine, which is designed to protect against measles, mumps and rubella, is the one most accused of causing autism, a misconception that stems from the infamous, falsified Andrew Wakefield study that has been retracted and debunked to no end. In regards to these measles outbreaks, RFK Jr. stated,
"And we're trying to refocus the press. We've had 3 measles deaths in this country over 20 years. And we're trying to refocus the press to get them to pay attention to the chronic disease epidemic as you've asked us to."
All while he and the wider Trump administration continue to spread the very rhetoric that risks exacerbating the issue and causing more needless death. I think he was trying to present the situation as not serious enough to warrant the media attention it's receiving, but it comes across like they're trying to shroud the reality by distracting us with this big, scary autism epidemic. For autistics, as well as undermining a core part of our personhood as something bad we caught from a vaccine, it prompts all sorts of pseudoscientific treatments, cures, and reversal methods. For example, stemming from his unfounded belief that mercury-containing preservatives in vaccines causes autism, despite there being no mercury-containing preservatives in modern vaccines, and no evidence to support a connection between vaccines and autism, and plenty to the contrary, Kennedy promotes chelating compounds to treat autistics. These compounds are traditionally used for heavy metal poisoning, so in response to the pseudoscientific narrative of mercury in vaccines causing autism, so-called chelation therapy would supposedly facilitate the removal of this hypothetical mercury from the body, thus curing the person of their autism. This, unsurprisingly, doesn't work and has sadly resulted in at least 1 death when it was used off-label in this way. Kennedy does go on to reference some studies, but just as he did with the CDC report, he warps these studies to fit his preconceived autism epidemic narrative. He used 3 studies to pose that autism was very rare in the 1960s, 70s and 80s, and then contrasted these with figures from modern studies that display autism as relatively common. Even if we could hypothetically somehow rule out better diagnosis, more equitable access to diagnosis and so on, and could somehow objectively say that identification prevalence accurately reflected true prevalence, we still couldn't conclude a rise in autism prevalence because the old studies aren't measuring the same thing as the modern ones. All three of these older studies use definitions of autism that are now defuncted. Notably, the most up-to-date concept of autism is a lot wider than these outdated ones, so naturally more people fit into the newer autism criteria. While there have been people we can retrospectively describe as autistic for pretty much all of human history, autism as a label is relatively new. The article How Autism Became Autism by Bonnie Evans explains how the term autism, as coined in 1911, doesn't refer to the same thing as it does today. Initially, autism referred to, quote, the most severe cases of schizophrenia in infants. These children were said to be unable to follow logical rules or think conceptually, and had a predominance of visual imagery in their minds. They were described as morbidly self-absorbed, which is reflected in the etymology of the word autism. Psychologists, psychoanalysts, and psychiatrists used the word autism with this meaning throughout the 1920s and up until the 1950s. The diagnoses of schizophrenia, psychosis, and autism in children were largely interchangeable during the 1940s and 50s. But in the 1960s, autism was completely reformulated. From the mid-60s onwards, child psychologists used the word autism to describe the exact opposite of what it had meant up until that time. Whereas autism in the 1950s referred to excessive hallucinations and fantasy, egocentricity, and ego hypertrophy, autism in the 1970s referred to a complete lack of an unconscious symbolic life. The autistic child now did not fantasize at all. Neither of these descriptions describe autism as we know it today. In 1943, Leo Kanner stated that he had identified a unique psychological disorder in children. If you strip away all the pathologization and the notion that it was rare, he was pretty much describing a preliminary version of autism as we know it today. Rather than attributing complex unconscious thought processes to children that he observed, he described the behavior of a group of children with similar traits. However, this descriptive mode in child psychiatry was not standard at the time, and many other child psychological professionals continue to employ the concepts of autism in conjunction with the original meaning characterized by autoeroticism, primary narcissism, and symbolic thinking. Kanner's description of autism wouldn't be adopted until years later, as there was a shift away from Freudian analytic concepts concerning the unconscious and towards studying observable behavior. Broader shifts in child psychiatry, psychology, and psychoanalysis led to further alterations of what autism meant, in turn making the diagnostic criteria for autism wider and applicable to more children. Changes in diagnostic methods from the 60s to the 80s meant that autism came to be associated with, quote, profound mental retardation and other developmental or physical disorders, thereby increasing the numbers of children who were considered to display autistic traits. More recent increases in autism diagnostic rates can be partly attributed to diagnosis of those without intellectual or learning disabilities, who would have been largely overlooked in previous decades, as well as adults. Even some autistics who did have an intellectual disability were diagnosed with mental retardation, and that one diagnosis was deemed sufficient to explain their behavior and traits. Nowadays, those who have or suspected to have some sort of intellectual disability are routinely also evaluated for autism, so are more likely to be formally diagnosed as autistic. As autism was associated further with developmental conditions, hallucination was increasingly eradicated from the concept. These changes were reflected in the publication of the DSM-3 in 1980, which was the first time autism was included in the DSM. The older concept of autism was removed as a key concept in the diagnosis of adult schizophrenia, and was implemented as a category within pervasive developmental disorders of childhood. The childhood schizophrenia category was completely written out, and the pervasive developmental disorders category was introduced. This diagnosis included 4 subcategories: infantile autism, childhood onset pervasive developmental disorder, residual autism, and an atypical form. While we can't pinpoint exactly when autism became autism as we know it today, due to the gradual and still ongoing evolution of the term, most of those who were diagnosed with a pervasive developmental disorder from the DSM-3 would still be considered autistic today. The main issues at this point were the discriminatory diagnostic services, narrow diagnostic criteria, and general lack of awareness, which led to under-recognition and exclusion of huge amounts of people who fit modern autism criteria. Understanding autism as a spectrum, the DSM-5 of 2013 consolidated autism subcategories into one wider diagnosis. While we still can't use modern autism identification stats as accurate indicators of actual autism prevalence, this brief overview of the radical shifts in autism conceptualization over the years makes it very clear why we extra can't use these old studies as accurate representations of autism prevalence at the time. Anyway, in respects to the 1970 Wisconsin study Kennedy mentioned, there were other studies published around the same time with higher estimates. While these figures still can't in good faith be compared to modern figures, it's suspicious that Kennedy chose to use this study with the lower estimate that just so happens to create a more dramatic juxtaposition when compared with modern figures. In a preceding interview, when discussing this Wisconsin study, Kennedy falsely claimed that
all the kids in Wisconsin were tested.
In reality, data was obtained via records from between 1962 and 1967 from all of Wisconsin's children's treatment facilities, and the number of cases of infantile autism, a now defunct diagnosis, for children aged 12 and under were counted. It could be argued that some of the children who were counted under the labels psychosis of childhood with later onset and psychosis complicated by demonstrable organicity in the study might have been labelled autistic based on modern standards. This study defines childhood schizophrenia as, quote, a heterogeneous group of syndromes which includes, but is not restricted to, infantile autism, end quote. It later states, quote, group differences seem less compelling than the similarities and do not conclusively point towards early infantile autism as an entity apart from childhood schizophrenia, end quote, which aligns with how the two were often grouped together around that time. The study also recorded very high male to female ratios in all the subgroups, which, when viewed in the context of modern diagnostic data, suggests that a significant amount of autistic girls were unaccounted for. On top of this, there would have been a significant amount of autistic children who would not have made contact with these treatment facilities, so wouldn't be in the records, again leaving these children unidentified in this study. Getting back to the point, 70 unduplicated cases of infantile autism were identified in these clinical records. This figure was then divided by the population to get an estimated rate. So no, not all the kids in Wisconsin were evaluated, as Kennedy stated. Could Kennedy have just made an honest mistake? Sure, but in this conference he made a suspiciously similar mistake when he falsely claimed that the researchers of the 1987 North Dakota study
even conducted in-person assessments of the entire population of 180,000 children under 18.
When they did not. Instead, they collected records of children aged 2 to 18 in North Dakota who had met the DSM-3 criteria for pervasive developmental disorders, and they conducted in-person assessments of around 200 children. When referencing a third study, one that used data from 1956 to 1965, Kennedy said,
autism, a condition characterized by profound impairments in social communication and behavior, would have stood out like a neon sign.
Again, the term autism in the 60s didn't mean the same thing as it does today. Additionally, since autism wasn't nearly as widely recognised as a concept as it is today, children who displayed autistic traits were disproportionately more likely to be misdiagnosed or waved off as a troubled kid with behavioural issues. So perhaps some of these autistic kids did stand out like a neon sign, but instead of parents, teachers, psychologists, etc., attributing their behaviour to their autisticness, they were misattributed to something that was more commonly diagnosed at the time, such as schizophrenia, psychosis, or mental retardation, as it was called at the time. Even if an autistic genuinely did have, say, an intellectual disability, for instance, it would be likely that a psychiatrist would give them the mental retardation diagnosis and call it a day. Their autistic traits would be written off as part of their intellectual disability. But today, as previously mentioned, individuals who have or suspected to have developmental, intellectual, and/or learning disabilities are often also evaluated for autism. While misdiagnosis of autistics is still an issue today, it was significantly more common in the 60s and even the following decades. If in earlier decades we somehow had the modern conceptualization of autism and the associated diagnostic criteria, along with our modern level and quality of awareness, understanding, resources, opportunities for evaluation, and so on, there would have undoubtedly been multitudes more autism diagnoses administered, and even then there would still be a significant amount of undiagnosed autistics as there are right now. Especially since he mentioned things like stimming and toe walking, I'd be surprised if Kennedy was unaware of masking and camouflaging. Many, if not most, autistics learn to mask and camouflage, whether consciously or subconsciously, as a trauma-induced coping mechanism to avoid the disfavourable treatment and potential danger that often comes from being and acting autistic. In my opinion, Kennedy doesn't mention the possibility of autistics being underidentified due to masking and camouflaging simply because it doesn't fit his narrative. All that to say, autism wouldn't necessarily have stood out like a neon sign, as Kennedy professes.
The California legislature directed the Mind Institute at UC Davis to answer the question. And 𝖍𝖕𝖕𝖊𝖗𝖘 is a highly esteemed, revered scientist, neurology, and epidemiologist, came back with a definitive answer: the epidemic is real. Only a very, very small portion of it can be changed to can be charged to better recognition or better diagnostic criteria.
It seems like he's conflated two studies into one here. Presumably he was thinking of a 2002 report which was not authored by 𝖍𝖕𝖕𝖊𝖗𝖘, but by Dr. Robert Bird, who wrote the flawed study for the Mind Institute at UC Davis. This study stated, quote, "There is no evidence that loosening in diagnostic criteria contributed to an increase in the number of children with autism," end quote, or more accurately, children identified as autistic in California's developmental services system. The authors boldly concluded, quote, "Without evidence for an artificial increase in autism cases, we conclude that some, if not all, of the observed increase represents a true increase in cases of autism in California," end quote. It's worth noting that this study didn't look into factors such as increasing awareness, which might have led to more parents seeking support services for their children. So while it's speculative to conclude that some of the observed increase represents a true increase, to say, if not all, is a huge reach. Nothing in this study justifies such definitive statements. Despite not being peer-reviewed and having been criticized by other scientists as having unwarranted conclusions, the popular press at the time presented it as conclusive, just as Kennedy is doing now. CNN, the New York Times, and other major press at the time all inappropriately portrayed this study as definitive scientific fact, And needless to say, they all pathologize autism to an emetic extent. Since he named 𝖍𝖍𝖕𝖊𝖗𝖘, Kennedy might have been thinking of a study that this researcher published in 2009. It found that, quote, changing age, a diagnosis can explain a 12% increase, and inclusion of milder cases, a 56% increase, end quote, in reference to increasing numbers of people eligible for state-funded autism services in California between 1990 and 2006. Note that autism cannot be mild or severe. This language is just a symptom of neuroprovincialism, but I'm trying to keep on topic here, so we'll leave that for another day. The use of the phrase inclusion of milder cases relates to the broadening of the autism diagnostic criteria between 1990 and 2006. In the conclusion, the authors state, quote, younger ages at diagnosis, differential migration, changes in diagnostic criteria, and inclusion of milder cases do not fully explain the observed increases. Other artifacts have yet to be quantified, and as a result, the extent to which the continued rise represents a true increase in the occurrence of autism remains unclear, end quote. In this case, we can't say how much of the observed increase is due to more awareness and understanding, desire to access autism services, and other potential contributors, and how much represents an actual increase in autistic individuals. There have been a few other studies that attempted to quantify the impact of certain changes, and they very generally estimated that between a quarter and a third of the increase in autism identification can be attributed to a single factor, such as diagnostic substitution or a change in diagnostic criteria. No study so far has attempted to account for all potential contributing factors. Experts are skeptical, generally finding such attempts to quantify these potential contributors dubious. I personally don't feel comfortable speaking on the validity of these types of studies because while I can't comprehend how they can apply a model of wider diagnostic criteria onto a retrospective population, I'm not a scientist or researcher or statistician or anything like that, so it doesn't say a lot that I don't understand. It can be confidently asserted that factors including diagnostic changes have contributed to increases in autism identification. We just don't know for sure how much all these factors contribute and whether there has been a significant rise in actual autism prevalence or not. Despite all this, Kennedy boldly claims,
There are small slivers of the autism epidemic, maybe 10% to 25% according to the studies. The highest studies are around 25%. That can be attributed to better recognition and better diagnosis. That means 85% are still, or 75% to 80% are part of an epidemic, and that's too many. And that is what we need to redress.
The 𝖈𝖍𝖕𝖊𝖗𝖘 study that he kind of potentially tried to reference actually goes against his assertion, as does pretty much every semi-trustworthy study on the topic. He's just throwing out numbers and pretending they're substantiated. His psychologist buddy, Walter Saharodny, added,
There's better recognition of autism and better awareness because there are more children with autism, and the professionals have greater reason to learn from what their experience and to diagnose. I wish the contrary was true, but it's not like better awareness pushes something that's not there. Rather, something that's there is being recognized.
This circular logic thing is literally exhausting. Yes, we're recognizing something that's there, but it's always been there, and in comparable proportions of the total population. There are a lot of autistic people, and a significant amount are still undiagnosed and misdiagnosed, so aren't even reflected in diagnostic stats. We're everywhere, and while these bigots obviously don't like that fact, that's not why they're saying there's an autism epidemic. They're specifically referring to this alleged huge ongoing increase in actual autism prevalence, which just doesn't exist. Upon reviewing the science and employing basic logic, I'm really not convinced that there has been a significant increase in autistic people beyond maybe what would be expected with general population growth. However, if we did hypothetically somehow prove that autism prevalence has actually notably increased, which wouldn't be a bad thing, this still wouldn't necessitate an environmental cause of or significant contributor to autism. For example, it could be argued that better support and the improvement in societal acceptance could facilitate more autistics who want to do so having biological children. More autistics reproducing means more autistic children. But even if we hypothetically discovered that there were significantly more autistics and could hypothetically rule out genetic-based explanations and could hypothetically attribute the increase to some consistent environmental factor, so what? Even in the near impossible outcome of vaccines or fluoride or electromagnetic fields actually being proven to cause autism, not even this absurd hypothetical situation would constitute an epidemic. An autism epidemic is inherently impossible because autism is not a disease. A possible increase in autism, no matter the cause, would only be alarming to bigots who think there's something bad about being autistic. I want to finish off by talking about the troubling possibility of the creation of an Autism Registry. At the beginning of this press conference, RFK Jr. stated, in the context of autism identification numbers,
We're going to have updated real-time data.
But didn't elaborate much beyond that. On the 21st of April, a few days after Kennedy's conference, a proposal for a national autism registry was released as part of a presentation by the director of the National Institute of Health. He described how the NIH would be, quote, developing national disease registries, including a new one for autism, to be integrated into a, quote, real-world data platform to study autism and chronic diseases. The new data will allow external researchers picked for Kennedy's autism studies to study comprehensive patient data with broad coverage of the US population for the first time. I want to note that this situation is still evolving, so I can only speak on the information that's publicly available as of recording. The Autistic Self-Advocacy Network is an excellent resource if you want to keep up to date with all this stuff, and is an excellent organisation in general. Also, I'd recommend taking a look at neurodivergent_rebels Substack for updates in this situation, as well as insights into all kinds of neurodivergent related topics. Anyway, this proposal, as of current, leaves many unanswered questions. It fails to explicate what data will be included and from what sources, if personally identifiable information will be collected, and if so, if there will be opt-out options, if people will receive any notice that the information is being used, or how specifically data will be used, anonymized, and secured. We still don't even know the specific purpose of this proposed data platform, only that it will be used in nondescript ways to facilitate studies that are likely to be no more than pseudoscientific autistiphobia to facilitate the government's mission of eliminating us. According to CBS's reporting, quote, medication records from pharmacy chains, lab testing and genomics data from patients treated by the Departments of Veteran Affairs and Indian Health Service, claims from private insurers, and data from smartwatches and fitness trackers will all be linked together, end quote. Despite the NIH's professions that, quote, these efforts are not about tracking individuals, The plan to collect data from sensors and wearables makes me fear that autistics are going to end up being GPS monitored like we're sex offenders or something. The possibility of personally identifiable information being collected is probably the biggest concern, because corrupt leaders having a list of people they want eradicated has historically not gone down well, to say the least. The Department of Health and Human Services has since claimed, quote, "We are not creating an autism registry. The real-world data platform will link existing datasets to support research into causes of autism and insights into improved treatment strategies," end quote. Whether you want to call it a registry, a real-world data platform, a data repository, or whatever else, it seems like the NIH is planning to amass private medical records from federal and commercial databases to aid whatever bunk studies RFK Jr. is planning to do. They're being very sketchy about the whole thing right now, so we don't know much beyond that. And as we've covered many times by now, autism isn't something to be treated, and attempting to do so is incredibly harmful in a multitude of ways for the individual victims and neurominority groups as a collective. If personally identifiable information does end up being disclosed, whether deliberately or through carelessness, there are real risks of exposing these people to discrimination and stigmatization, and could potentially lead them to being targets for dangerous so-called treatments or cures, among other troubling possibilities. As for all the autistic children who are too young to give informed consent, I firmly oppose parental consent being used as a proxy, because obviously not all, or even most, but a notable amount of parents of autistic kids fit into the conservative, ABA-loving autism mom stereotype, who are autistiphobia and want to cure their kids, and whether intentionally or not, are terrible, abusive parents. These type of bigots already speak over us enough and have done incredible harm to individuals and the autism community as a whole. Under previous administrations, autistic people, advocates, and other relevant organizations had direct lines of communication with autism policy experts within the HHS. But under the current administration, the HHS are seemingly refusing to engage with the autistic community and civil rights advocates. If a proposal purported to help a certain community strikes fear in that very community, there might be a problem. This data collection could be used for good, potentially helping researchers and policymakers better understand and meet the needs of autistic people. If used for research that autistic people actually want and that prioritizes our inputs, I don't see an inherent issue with amassing relevant, non-personally identifiable information in a responsible manner. However, given that America continues to descend deeper into fascism, and the administration has been very clear that they would like us to not exist, has continually spouted dangerous eugenic rhetoric, and has a predilection towards unethical pseudoscience and straight-up lying, I truly believe that this type of data could be used to surveil, oppress, and ultimately attempt to eliminate autistic people. And given that they are actively stripping privacy protections from other marginalized groups they don't like, the administration's professions of state-of-the-art protections for this new registry doesn't provide much assurance. The Trump administration has already demonstrated that it doesn't respect the privacy of vulnerable communities. Take, for instance, Trump's executive order entitled, quote, "Protecting Children from Chemical and Surgical Mutilation." Despite its name, this order doesn't intend to protect children from legitimately harmful practices such as female genital mutilation or non-therapeutic child circumcision. but intends to further oppress transgender people by limiting access to potentially life-saving care. Under this guidance, healthcare workers, clinic staff, and even third parties may file complaints against providers offering gender-affirming care, and in many cases disclose protected patient information under HIPAA's whistleblower provisions. Why? Because the administration hates trans people and wants them not to exist. As HHS Secretary, RFK Jr. chooses which researchers to invite, which is yet another cause for concern. I'm confident that Kennedy will pick researchers who are most likely to provide his predetermined outcome regarding autism causes. That's to say, corrupt researchers with a tendency to overlook basic scientific standards and ethics. He's already done it before by hiring fellow conspiracy theorist David Geer to head the study into vaccines and autism that was announced a couple months ago. Among other scandals, Geer was fined for practicing medicine without a license after he conducted dangerous illegal experiments on autistic children in attempts to de-autism them, all while enriching himself. He and his father have published numerous fake studies that claim a link between vaccines and autism. The hiring of Geer affirms the suspicions that many of us have, that the administration plans to rig these autism studies to further the vaccines cause autism farce. We don't know yet whether Geer specifically would be one of the researchers who would have access to autistic people's private medical information, but if the other researchers are anything like him, they could do serious damage if given access to this information. Here's an excerpt from a statement from the Autistic Self-Advocacy Network. Quote, "Medical data can also easily be manipulated by unscrupulous researchers to create the appearance of causation where it does not exist. This has already happened this year with an anti-vaccine study about autism that RFK Jr. approvingly cited during his confirmation hearing. The study, which was not published in a reputable scientific journal and did not go through peer review, used Medicaid data from Florida to show that children who had doctor's visits to receive vaccinations were statistically more likely to also have doctor visits to receive care for autism. The authors claimed that this demonstrated that getting vaccinated could cause autism. All this proved is that parents who take their children to the doctor are more likely to both get their children vaccinated and to have their children evaluated for autism and to get them care if they are autistic. Handing over huge amounts of data to people like these researchers would increase their ability to mislead the public by generating phony evidence for RFK's predetermined conclusion, a link between vaccination and autism that real scientific studies have disproved over and over and over again." End quote. Since this video focused mainly on fact-checking Kennedy's autism epidemic narrative, we didn't discuss much of the more bigoted things he said about autistic people. We did briefly mention how he presented us as life unworthy of life and useless eaters, and spouted other rhetoric that veers troublingly close to that eventuated in the T4 euthanasia program, which was a Nazi-perpetrated genocide against disabled people, including autistics. Obviously, we're not at that level yet, and hopefully we'll never get to that point ever again, but these things notoriously escalate step by step, such that we might not fully realize it's happening until it's our present reality. So we must recognize and respond to warning signs from the past. Kennedy has also presented the idea of sending people to wellness farms to be reparented. RFK Jr. isn't the only member of this administration who has repeatedly spouted eugenicist talking points. According to his nephew, Trump said that disabled people should just die, and Elon Musk publicly supports, promotes, and I would argue participates in eugenics. from weird, far-right, patriarchy, racism and eugenics-based pronatalism to the Great Replacement and white genocide conspiracy theories, to now this whole autism extinction mission. The administration as a whole is reviving dangerous eugenics ideology. These people just say stuff, so it's difficult to discern which of their statements should be taken seriously. Regardless, their statements indicate their potential to cause serious harm. These people cannot be trusted with lists of marginalized people, and our fears are very reasonable when considering historical events and current policy pursued by the administration. America, as with many other countries, has a long, troubled history of eugenics that led to heavy-handed governmental intervention in marginalized people's lives, including governmental efforts to find and track disability for the purpose of eliminating it. Queer people, women, disabled people, including autistics, Indigenous people, Black people, Latino and Hispanic people, people of color in general, were among those targeted. These people were subjected to forced institutionalization, forced sterilization, and forced experimentation. In some cases, these injustices are still happening. Forced experimentation on disabled people is perhaps most relevant to this discussion, so I think it's important to provide some examples as historical context. Beginning in the early 1900s, hundreds of thousands of disabled children in America, along with children who were poor, uneducated, or abandoned, were sent to institutions by state governments, with their so-called feeble-mindedness being used as a justification to violate their rights and autonomy. One of these institutions was the Fernald State School. The school enticed kids into joining a science club by offering them tickets to Boston Red Sox games, trips off school grounds, gifts like Mickey Mouse watches, and lots of free breakfasts. Free breakfasts that, unknown to them, consisted of oatmeal laced with radioactive tracers as part of a nutritional study for the commercial interests of Quaker Oats. In Willowbrook State School, another one of these state-supported institutions, NYU medical researchers intentionally infected disabled children with hepatitis for a study that occurred from 1956 to 1971. Multiple subjects became lifelong carriers of hepatitis, suffering long-term or permanent health effects, including liver damage and shortened lives. In the 2000s, we had David Gear's aforementioned illegal experiments on autistic children, and in 2020, the DOJ found a state-run institution called the Glenwood Resource Center to have experimented on disabled children. Under RFK Jr.'s leadership, the administration's Make America Healthy Again initiative threatens to resurrect these harmful legacies under the guise of health, treatment, and public order, with state and local policies already paving the way towards forced treatment and re-institutionalization. These past injustices are not mere relics of history, they're warning signs. Perhaps I'm overreacting, perhaps I'm underreacting. Due to the vagueness of this proposal, we really don't know what to expect. While I can't predict how bad this will get, I am confident that if this proposal goes ahead, autistics will be harmed more than helped. In saying that, we don't know if personally identifiable information will be collected, and at least as of now, there's no indication that this database will be used to target or round up autistic people. In conclusion, autism is not a disease, there's no autism epidemic, and this is just another example of the Trump administration trying to eradicate social minorities who they don't want sullying their pure Aryan, American population. I don't even know what to say to the autistics and queer people, especially trans people and immigrants in America right now, and everyone else being targeted. Human history doesn't progress linearly, and we're experiencing a huge dip right now in terms of basically everything. It's not always going to be like this, which is good, but it doesn't negate the huge amount of suffering and bloodshed that's happening right now. A positive that's came out of this specific situation is that it's demonstrated how strong the autistic community and our allies are, and hopefully our collective efforts will prevent the worst possible outcomes. Thank you for watching, and please try to take care of yourself and each other if you can.
Every time they turn the lights down.